So in trying to repair the inguinal hernia, there are actually two methods or two things you might want to opt in for. Okay, it could be that you are doing a primary tissue repair. That means you are repairing the inguinal hernia, but you are using the patient's tissue. Or it could be that what? It could be that you are using a mesh. Okay, so it could be primary tissue repair or mesh. Okay, so for the primary tissue repair right now is what we'll be looking at. Okay, so primary tissue repair for inguinal hernia, that's like another method of what? Herniorrhaphy. So in this primary tissue repair, yes, you are opening the patient up, you are releasing the hernia, and you are still using the patient's tissues to repair the thing. So it has some disadvantages, it has some advantages, has some disadvantages. That's what we'll be looking at. Alright, so we'll be looking at this from what? Definition, the steps involved or the procedures, then the types of what? Tissue repair. Look at the advantages, look at the disadvantages. Alright, look at the indications or contraindications. Of course, one of the advantages could be that you are not using a mesh, so the patient will not be feeling like there's a foreign substance there, there's a foreign object there, and the patient will not. Some patients, it will also reduce the risk of what? The patient reacting to the materials that were used in making the mesh. Do you understand? So, but the disadvantages could be that the hernia could reoccur again. Alright. So primary tissue repair for inguinal hernia, also known as herniorrhaphy, is actually what? A surgical technique that uses the patient's own tissues to repair the hernia without using a mesh. Okay, so the steps involved include: you do an incision, so small incision is made in the groin area. Dissection, the hernia sac is dissected and separated from the surrounding tissues. Reduction, hernia sac is reduced and pushed back into the abdominal cavity. Closure, the defect in the inguinal canal is now closed with what? Sutures. And this is usually what? The patient's own tissues. Alright, reinforcement, the repair is reinforced with additional sutures or tissue layers. Right. Then types of tissue repair, we have the Bassini repair. This one is a classic technique using a single layer of sutures. Then we have the Shouldice repair. This one is a modification of the Bassini technique with multiple layers of sutures. Right. So the Shouldice is thing like 3 layers. Right. So in the Shouldice there's a lower risk of what? Reoccurrence. Then we have the McVay repair. This one is a technique using a relaxing incision, okay, to reduce tension on the repair. Alright. So talking about the advantage, no mesh is used, so there's reduced risk of what? Mesh-related complications. It could be that the patient will react to the mesh. It could be that what? There will be mesh translocation. The mesh will move from where you put it to another part of the body, causing all this problem. And there's also a lower risk of what? Chronic pain or foreign body sensation. Okay, that it can be performed under local anesthesia. Alright. Then the disadvantages. This one, you're using the person's what? Own body tissues. Now remember that what? The body tissues were there before. You are still using them, so that means there's a high risk of what? The hernia coming back. Right. It requires more technical skill and experience. When you start talking about Shouldice method, you suture this one to the inguinal ligament, you suture this one to what? It's so crazy. Right. So it requires more technical skill than just taking a mesh, putting there, covering. Okay. It may not be suitable for large or complex hernias. Right. Indications: if the hernia is small or moderate size, you can use it. If the patient has mesh allergy or sensitivity, you can use it. Just use the patient's own skin. If the patient prefer a mesh-free repair, you can use it. Then contraindications: if the hernias are large or complex, you don't use it. If there's a poor tissue quality, you don't use it. If the hernia has been coming back, if you have been doing previous surgeries to repair with the patient's own tissues, then you stop using it. Right, so that's it about the primary tissue repair for inguinal hernia. I'll be seeing you guys pretty soon.